Hello, viewers. Welcome to another episode of Your Health, Your Priority. It is of utmost importance that we bring to you this episode of Your Health, Your Priority. Today, we will be looking at a very important topic that is the glaucoma, a silent killer of which a lot of persons don't know about. So, sit tight as we bring you this session today. Glaucoma happens to be a disease condition that affects one of the major sense organs in the human body, and that is the visual apparatus, popularly known as the eyes. And glaucoma is a chronic progressive disease that is caused by damage to the optic nerve, which usually leads to loss of vision. The optic nerve happens to be a nerve or fiber that connects the retina, which is a part of the eyes, to the brain of the human, and a damage to the optic nerve is what leads to what we call glaucoma, and popularly the end point of it all will now be loss of eyesight. Talking about the types of glaucoma, we have different types of glaucoma. We have the open angle glaucoma, the angle closure glaucoma, we have the low tension or the normal tension glaucoma. Not just that, we have the congenital glaucoma, the inflammatory glaucoma, and then we also have the neurovascular glaucoma. All these are different types of glaucoma. Persons have different kinds of glaucoma. So looking at glaucoma in a broad sense, there are also different types of it. The best way you can use to get to know which exactly affects you is going to the hospital for an eye checkup. But now we come to the causes of glaucoma. When you talk about glaucoma, many factors can lead to glaucoma, but there is no specific known cause of glaucoma. But medically speaking, increased eye pressure is one of the only modifiable risk factor known for glaucoma at this point in time. We also need to note very quickly that glaucoma can also develop with normal eye pressure. So basically, the major cause of glaucoma is increased eye pressure. We now come to the risk factors associated with glaucoma. Now, anyone can develop glaucoma, but we need to understand that some persons are at a higher risk of developing glaucoma as a disease of the eye. Certain risk factors associated with glaucoma could be raised. Of course, research shows that a good number of Africans are cases of blindness results from glaucoma. Not just race, age could be a risk factor to glaucoma, because persons who are aged, let's say 50 years and above, are more at risk of getting this glaucoma. And then talking about family history, persons who have history of an individual in the family with this disease condition are also at risk of this disease called glaucoma. Increased eye pressure or increased pressure inside the eye, persons who experience this are equally at risk of this. And then finally, on the risk factors of glaucoma, you see decreased corneal thickness to be one of the risk factors associated with glaucoma. Like I made mention earlier, glaucoma basically affects the optic nerve, which happens to be a nerve of fiber that communicates from the retina to the brain. Signs and symptoms of glaucoma. Most persons may have this disease of the eye but may not know, because from the onset symptoms may not present itself. That is to say that at the early stage, glaucoma tends to be asymptomatic, but progressing with time, the signs begins to develop. That is when you get to adulthood, age 15 and above. Now, the damage to the optic nerve could lead to an individual to begin to have some small blind spot images in the eye, and this blind spot usually occur inside the eye or in the peripheral visual angles of the eye. Not just that, blurred vision or narrowed field of vision could also be a symptom of glaucoma. Severe pain in the eyes could be a symptom as well. And then seeing halos or rainbows around light. An individual tends to look at a field of space where there is light. The message that is going to the brain is that the person is seeing some sort of kind of rainbow in the eyes. That could be a symptom of glaucoma. Loss of vision is one of it. And then finally, let me just look at this, popularly known by everybody, headache. Though it may be trivialized, but unnecessary headache could be a symptom of glaucoma as well. But now we come to the diagnosis of glaucoma. Upon visit to the hospital, your eye healthcare provider or your eye doctor, which we all know as the optician, will first take your complete medical history, and then from there he or she will examine your eyes. Now, a following test may be carried out to diagnose glaucoma. Now, the popularly known visual acuity test will be carried out. That is the one we all know about. You get to the hospital, one eye will be closed, you will then be asked to read the letters of the alphabet from a distance, letters of the alphabet of different sizes and the likes of that. That's the visual acuity test. Of course, that will be carried out on you as one diagnosis of glaucoma, not just that, pupil dilation, visual field inspection. A tonometry test will also be carried out. A tonometry test is the test that determines the fluid pressure inside your eye. And then optic nerve imaging will also be carried out. That is taking photos of the eyes to determine the level of damage in different areas of the eye. A pachymetry test will also be carried out. What is a pachymetry test? Is a test that is carried out to know the thickness of the cornea in the eye. These are just few diagnostic tests that will be carried out on an individual who visits the hospital with issues or complaint of the eye, trying to find out whether or not what troubles the eye of that individual is glaucoma. Alright, coming down to the treatment of glaucoma. Different kinds of treatments can be administered in a bid to cure, prevent, or lessen the effect of glaucoma in a patient. Number one, the use of eye drops. Upon eye examination in the hospital by an optician, based on the findings from the examination of your eye, certain eye drops can be prescribed for you to get to help lessen the effect of the eye defect in which the individual is going through. So number one treatment for glaucoma could be the use of eye drops. Secondly, oral medication. Certain medications will be prescribed for such an individual, of which can be taken orally. Not just that, a laser surgery could also be carried out on the eye, and then a microsurgery amongst others can also be carried out on the eye. So these are just few treatments for glaucoma. I made mention of the use of eye drops, oral medication, laser surgery, microsurgery, and the likes of it. Prevention of glaucoma. Is glaucoma actually preventable? Can I prevent glaucoma? You cannot prevent glaucoma, but when found at the early stage, there are certain things that you can do that can lower the risk of this eye damage. Number one is to have regular eye examination. That's just one way you can use to prevent glaucoma. Regular eye examination. For persons who have family history of glaucoma, it is advisable that they visit the hospital for eye examination after every 1 to 2 years. And then for persons who don't have a history of this, a period of 3 to 5 years is ideal for them to always visit the health center or the hospital for eye examination. Secondly, you need to learn about your family history. They say prevention is always better than cure, which is fact, it's no fiction at all. Knowing about your family history is also a key way in preventing glaucoma. How do I mean? When you get to know whether or not someone in your family or your bloodline has glaucoma, then you would be able to know that, okay, you need to get to visit a health center early enough for eye examination. Now, you also need to follow the doctor's prescription and instruction. Some persons, when they get to the hospital, prescriptions are given to them, they take it. When they begin to feel a little bit okay, they begin to exhibit some level of nonchalance towards the medication. We are all advised today, when you visit the health center, following doctor's prescription or instruction to the letter is very, very important. And regular exercise could also help in preventing glaucoma. Not just that, protecting your eyes. The eyes happens to be a very important organ in the body, categorized as one of the major sense organs in the body. So you need to protect your eyes as an individual. How do you do that? Some persons go for swimming without swimming glasses. Some persons walk under hot sun without sunshade. All these are not good. We are encouraged to protect our eyes the best way we can. Not looking, persons who are used to ICT gadgets, you need to get lenses that can help lessen the effect of the rays of light entering into your eyes. These are just few ways in which glaucoma can be prevented. As we come to the end of today's section of Your Health, Your Priority, we are looking at glaucoma, please be reminded, and we are talking about the tips of living with glaucoma right now. We need to understand that glaucoma is a lifelong condition and needs conditional follow-up with your eye doctor. However, there are certain things that you can do to help keep your eyes healthy as an individual. Regular exercise is one of them. Secondly, eating healthy meals and diet is another one. Now, taking your medication as and when due is also very, very important. Now, we need to note that taking your medication alone is not good enough. As and when due is what we're talking about here right now. Taking your medication as and when due, as directed by your physician. And also, you have to avoid smoking to maintain a healthy eye, because smoking raises your blood pressure and in the same vein raises your eye inflammation. And then you also need to watch out for your caffeine intake, because caffeine raises the eye pressure, elevating your head. Some persons are found of sleeping without pillow. The use of pillow when sleeping could help to lower your eye pressure. You need to protect your eye, like I said earlier, in the prevention of glaucoma. And then you need to note that when you take your medication, either an eye drop or oral medication, the tendency of you to experience a little itching in the eye is there, but we are encouraged not to rub the eye, not to scratch the eye. You may be causing much more harm than good. Yes, the itching may be there, but you need to try your best possible to be disciplined not to rub or scratch your eye, because you may be causing much more damage to the eyes than good. These are just few tips on living with glaucoma. As I wrap up today's section of Your Health, Your Priority on glaucoma, I would like to advise my viewers out there that prevention, they say, is better than cure. It's no fiction at all. Glaucoma happens to be the leading cause of irreversible blindness in the world today. We need to note that glaucoma is a silent killer, in that from the early stage it may be asymptomatic. That is why proper preventive measures need to be put in place. Early detection and treatment of this glaucoma is the most important step to prevent vision loss. Do your best necessary to protect your eyes, because it is one of the most sensitive parts of the body. The visual apparatus, which happens to be the eye, is to be taken care of every day, every time, and everywhere. Thank you for staying tuned to today's episode of Your Health, Your Priority. See you in the next episode of Your Health, Your Priority.